Our goal is to find breast cancer when it is still small, preferably when it is smaller than 1 centimeter or in the size range of 1 to 14 millimeter. Because then the long-term outcome of the patients is excellent. You see a 20-year survival curve of those cases that measured 1 to 9 millimeter, 10 to 14 millimeter. But then it is very important for the radiologist, where should I look? Where am I going to find most of the cancers on this mammogram? And also, what am I looking for? We have looked at the location of 1 to 14 millimeter small breast cancers in 981 cases. And we found that about 80% of the cancers are in the upper half of the breast, leaving about 20% for the lower half, and about 1 to 2% behind the nipple and the areola. But if we split the breast vertically, then we see that about 70% of the cancers are in the lateral half and about 30% in the medial half. These are extremely important guides for the radiologist. And if we look at which quadrant has most of the breast cancers, that's the upper outer quadrant. And the upper outer quadrant on the mammogram can be defined as a 3 to 4 centimeter area parallel with the edge of the pectoral major muscle. And now I know what I'm looking for. That is, we are looking for stellate lesions, circular lesions, and non-specific asymmetric densities. And this is what we call one of the forbidden areas. We call it Milky Way because this is a parallel path, like a parallel path up on the sky where most of the stars are. And indeed, about 50% of all breast cancers are stellate lesions. There are 4 very important areas on the mammogram where the malignant lesion can develop. One of them we call the Milky Way. The other one is the medial half of the breast, where we are looking for non-specific asymmetric density or circular lesion or stellate lesion. About 30% of the breast cancers are localized there. That is the value of the craniocaudal projection. And then the third out of the 4 forbidden areas is the retroglandular clear space, where we should only expect adipose tissue. If we find asymmetric density, stellate lesion, circular lesion, then we have to work it out. And then the fourth, the last one, is the area behind the nipple. Just about 1 to 2% of the cancers are localized here, but it is very important to detect and remove those cancers. This is the foundation for the masking technique. So as you see it here, this is the benefit of the masking technique. That is, we start at the edge of the pectoral major muscle, and with one little move, we are going to widen this area, and this is the magic area where 61% of all breast cancers can be found. We are going to look for asymmetric densities. We are going to look for circular lesions, stellate lesions, non-specific asymmetric densities. And look how beautifully the details come out. And after that, we can use this vertical masking. Step by step, side by side, we make the comparison. And so when we look at the craniocaudal projection, step by step, side by side, we stop here immediately because there is a non-specific asymmetric density. And that gives me the impression that this patient has to be called back for further examination. In fact, this turns out to be a carcinoma. And after this, we can look at the retroareolar area. Very seldom we find cancer here, but it is extremely important to find a cancer.